Well, I really discovered that I had diabetes by accident. Early 90s, I started taking, tablets for controlling my diabetes. But in 1995, I discovered that I had to be in insulin dependence because my sugar level from time to time used to go above the normal rate.
غالبية العائلات والأفراد يتجاهلون المرض ويعيشون حياتهم حياة طبيعية ويهملون جانب الحياة الصحية والغذاء الصحي.
تعتبر قطر من ضمن الدول الموجودة على قائمة الاتحاد الدولي السكري من ضمن 10 الدول المنتشرة في داء السكري. فنحن في مشكلة كبيرة فعلا يعني ليس فقط هناك في تكاليف منظورة وفي تكاليف غير منظورة يعني بالنسبة للسكري، فهو يكلفنا حتى اقتصاديا بالإضافة إلى أنه يكلفنا بطريقة غير مباشرة الغياب عن العمل، أيضا خسارة في الطاقة البشرية خاصة الناس المصابين بداء السكري.
Action on Diabetes was established in 2011. It was started by Maersk Oil. They were looking for a partner that could handle one of the big crises in this country, and that would be diabetes.
Well, we are really sponsoring the Action on Diabetes, and this bus is our mobile testing for diabetes. As you know, probably about 16% of people in Qatar have diabetes, and another around 14-15% are exposed to it.
It looks like about 1/4 of the population will be people with diabetes when we reach about 2030. So that is a national epidemic. It's a huge burden for the country, and there are so many aspects of diabetes. It's the elder generation, it's the young generation, it's the kids.
Working with Action on Diabetes added big value for Qatar and very big influential on the awareness about people about Qatar, and the logo of Action of Diabetes became iconic in Qatar, and everybody know well what does it mean and why we should all work against diabetes.
نعمل ضد السكري أعطانا الكثير من الطرق بالتعامل مع السكري في الرعاية الصحية الأولية، ونشكرهم على المجهود. أولا اللي هو عمل ورش التثقيفية أو ورش التعليمية والمستمرة لأطبائنا والممرضات والمثقفات الصحيات، وأيضا العاملين والمتخصصين في التغذية.
Action on Diabetes مجموعة فعالة تساهم في توعية الجماهير وتوعية الكادر الصحي ورعاية الأبحاث التي تساهم في تحسين مستوى الرعاية الصحية المقدمة لمرضى السكري في هذا البلد.
We do research. We establish a research base for diabetes. So establishing a baseline, finding out what is the problem currently and where are the gaps, how can we help close some of those gaps. And then it's about education, so improving the knowledge of nurses, doctors and other people who are involved in the healthcare of people with diabetes. And then it's awareness, general awareness, to make sure that the public understands what are the risk factors for developing diabetes and how can they do something about it.
So there are 2 types of diabetes. If we get type 1 diabetes, we will live with it all through our life and we'll have to manage it. Now, type 2 diabetes is the type of diabetes that you can avoid. Diet is the major or leading factor in combating diabetes along with exercises. So when we eat in a healthy way, let's say when we choose high fiber, low fat food, and we maintain moderate portions while following an active lifestyle, having exercise most days of the week, we will be making sure that our body is being more reactive to the insulin, and then we will protect ourselves from developing diabetes later on in life.
Educate yourself about your health conditions. Try to be fit, move around, Qatar provides with the young people with a lot of sports and areas, to walk and go around. Walk, run, exercise, do a lot of these things.
التمسك بالدين الحنيف، تعاليم الدين الحنيف من ناحية الصحة هو أساس الحياة الصحية والبعد عن وتجنب داء السكري.
Take control of your health, discover and enjoy healthy food, embrace an active lifestyle, because this will ensure you a satisfying, gratifying life that is free of chronic diseases.